have to treat that toenail fungus that doesn't look that bad. I mean, why worry about it? I can cover it up with toenail polish, can wear socks. I mean, if it's not smelling, what's the big deal? So, welcome back. I'm Dr. Olusegun, internal medicine here at Angelic Fungus. I'm going to be talking about today toenail fungus. You know, how do you even get it? What is it? And let's talk about, should you even treat it? I mean, is this just a cosmetic problem? And if it's just a cosmetic problem, why should I even worry about it? If we have time, I might also go into like natural ways to treat it, some prescription medications that we use to treat it, and some lifestyle changes that we can do to treat it, okay? So hopefully we have time for all that in this video. If not, you know, we'll make part 2. Okay, so let's get into it. If you've not yet subscribed to this channel, make sure you do that right now. You don't want to miss any of these videos. And also make sure you join our VIP's free school group where we talk about everything and go real deep into some of these issues, okay? All right, so toenail fungus, what is it? Okay, so we all know what fungi is, right? It's this non-bacteria, or I guess you can almost call it a parasite, that wants to live on your body. And in most cases, if our immune system is working well and you know we're in good balance with our gut bacteria, good bacteria, and so on, you know, fungus can cohabitate, right? They can live symbiotically with us with no problems. We start running into problems with yeast or fungi when our immune system is down. And they can start taking a hold and start overgrowing and start damaging tissue, and that's really where we are like, maybe gotta go, right? So with toenail fungus in particular, the reason why a lot of people don't like it, as you can see in the case of athlete's foot, for example, is that the moisture starts to cause it to smell, and it's just, you know, you don't want to be around someone with athlete's foot, as you all know, right? So that's an example of it starting to kind of like, not be so cute anymore, okay? And you can't just cover that up with the toenail polish. But most people have mild, you know, just discoloration of their toenails and feel like, yeah, if it's not bothering me, it's not hurting, it's not doing anything, maybe I don't have to treat it. What we really worry about in this case is that you never know when your immune system might be down. You might just be sick from some other upper respiratory infection, maybe gastrointestinal issue, and now your immune system is down. And that toenail fungus can now start to like have the ability or the opportunity to be opportunistic, right? It can start causing more problems. It can actually leak into your bloodstream and cause a systemic infection, which is what we really don't want to see, because this is very, very dangerous to your health, right? So what are the common things that people do naturally to try to help it? As you know, on this channel, my first thing is using food as medicine, right? We want to change that lifestyle that will help to prevent you getting this in the first place, right? Foods that are usually really high in sugars and carbohydrates are going to be your risk in terms of, you know, having fungus in the first place, right? Because why? These pathogens love to feed on sugars and carbs. And one of the ways we actually kill them off is we go no carbs. And when they don't have that to feed on, guess what? A lot of them die off, okay? So it's very important to understand that our diet can be a major prevention and also a major treatment. So when I see yeast infections in a patient, toenail fungus, it is a sign that your body is being probably exposed to too much sugars, too much carbohydrates for a long time, and that you've been feeding this beast and now they're showing up in your toenails, okay? So we definitely want to change that, and that's very easy to do. What is the next thing we can do? Very simple things like, you know, a lot of people think about, you know, taking supplements. What kind of supplements can I take? Most people are familiar with the B vitamin called biotin. Biotin is very good to help the nail grow. And so we do take this, not because it kills the yeast, but because it can help your nail grow if the yeast infection has started to cause problems where you now have discoloration, hardening, thickening, breakage, and so on, okay? So biotin inside of the B vitamins is what you can use to try to help to improve this problem. What else can we do? I usually encourage my patients to trim their nails, okay? This, for a lot of patients that are diabetic, you might actually need to go see a podiatrist because you have to be very careful if you already are diabetic and you have peripheral neuropathy where you're not getting a good sensation of feeling in your periphery. You don't want to be cutting because now you don't know if you're cutting deep into the tissue and you might actually cause an infection from hurting yourself, right? So very good advice to go see a podiatrist, go see a professional to help you trim those nails, okay? Trimming it down is gonna let whatever treatment that we do apply to really get into where that fungi is hiding. And as we say, this yeast, they like to grow like mushrooms, right? They like moist area, dark areas, and they like to feed on crap, okay? So we gotta trim so that we can be able to get, whether it's topical treatment, whether it's laser treatment, whatever treatment that we're using to be able to get deep into that area. So the other thing I like to tell patients to make sure they trim is the dry skin around their foot, right? This fungi likes to live in the crevices of like dry skin so that, you know, areas where blood supply is not getting to very well, so that the immune system, you know, they're trying to invade the immune system, not let the immune system know they're there. So for that reason, they're gonna kind of hide out in this dry, cracky skin on the back of your feet, you know, around your toes, and so on. So you want to get those also professionally removed in such a way where you're not hurting yourself, you're not, you know, filing it too thin where you're now actually cutting your skin, which is how they can actually get into your body systemically. Okay, so we want to clean that dry skin. We want to, you know, shave it off. We also want to make sure that we are trimming the nails, like I mentioned already, and that we are keeping that area dry. Okay, so for you athletes out there, yes, you guys are busy. Your socks and things like that. You definitely want to make sure that you're changing them often, you're washing them often, you're keeping that foot dry. You're airing out your shoes, right, so that they're not, you know, moist and not well aerated, where they're starting to like have that smell, right? So you want to make sure that you are keeping the area dry. Some people will put powders and different things, but it's still important to wash the inside of those shoes, make sure they're dry, hair them out and all that, okay? So those are the things that you can do on your own that is kind of very helpful. I'm going to talk about some natural topical treatments that you can apply on your own even before you have to visit a doctor to treat this, okay? So very, very common things that we use are things like Vicks Vapor Rub. Yes, Vicks Vapor Rub. You thought your grandma was crazy when she put it on everything, right? But actually for this, it's actually helpful because it's got camphor, it's got eucalyptus, it's got menthol, and these are things that can kind of like help you start to not basically make that. I also like tea tree oil. Tea tree oil is, you know, maybe a little bit more pricey than Vicks Vapor Rub, but it is still very, very effective against this type of pathogen. We love apple cider vinegar. So we've talked about using apple cider vinegar in a lot of different things on this channel, and you know, we love natural, healthy things that are good for you in general. So apple cider vinegar is going to be something that you actually soak your foot in. It's actually nice. After work, you get a little warm bath, you add some apple cider vinegar into it, you stick your foot into it, and you relax. Read a book, you know, catch up on the news, whatever, right? For a few minutes, maybe 15 minutes, 20 minutes, as long as you can tolerate. And this would really help get into those deep crevices and get that fungi killed, right? So I'm not really a fan of this one, but some people use it successfully. It's Listerine, okay? So as you know, I don't really like Listerine as a mouthwash. I'm not saying use it in the mouth. I definitely don't drink it, okay? As we know, there's some reason not to do that. But you can actually apply some of it, soak in it, kind of like you soak with the apple cider vinegar, and let it kill the fungi for you, okay? Then we use garlic. So I'm not a fan of the smell of garlic, and I know a lot of people are not either, but garlic, yes, just like you don't like the smell, the fungi also doesn't like the smell. So you definitely want to apply this. What you do is you crush it, and then apply it topically to the area. Your spouse might run away from you for a while, but at least you're killing the fungi, right? So maybe it's a trade-off. Anyways, but you can use actual fresh raw garlic, the oil from it, to actually kill this. Some people take the garlic pill. You have to take a whole, a good amount of it to be able to penetrate into the bloodstream and get to the foot. But topically applying it is actually sometimes a little bit more effective. And then we've got oil of oregano. Okay, so oil of oregano we use in a lot of things to support the immune system, to help kill viruses and bacteria and yeast and different things. So in this case, it can also help to kill yeast. So we want to basically use this. And the main ingredient in oil of oregano that does this is something called thymol. And we use this to really help diminish or reduce the amount of yeast that we might have. So there is a supplement some people use called caprylic acid. So caprylic acid you can find very abundant in coconut oil, and you can use this also as a supplement that you take to try to help with getting the yeast under control. So let's say you've tried this, you've changed your diet, you've cut down the sugars, you've done some of these topical things and some of these over-the-counter supplements. You've kept the area dry. You've had someone trim the nails for you and trim the dry skin for you. Then if those are not being effective, it might be time to go see your doctor, right? So let your podiatrist or your primary care doctor, your internist, family care doctor, let them know that this has been a problem. It's been going on for this many months or weeks or whatever the amount of time. And they might have to prescribe you some prescription medication. So the two most common ones that we prescribe are Lamisil, you might have heard of it. It's called itraconazole, or diflucan, which is fluconazole. So we can use either one of these to treat a lot of these infections. And sometimes some doctors prefer some over the other. Sometimes it's based on their experience, but there's also some suggestion that one might work for a certain type, like maybe athletes do better with Lamisil versus diflucan you might want to use for something a little bit more invasive and serious. So those are kind of some of the reasons why we might pick one over the other, but it's very important to understand these medications are very harsh on the liver. And so I don't like to go to them right off the bat if we can use some natural things or change diet and lifestyle to try to get this better. So Lamisil, for example, the way it works is that it basically inhibits the enzyme that the fungi uses to build their cell wall. Okay, so if you cannot build a cell wall, right, the cell is not going to survive, and then of course you don't have cells, you're dead, right? So that's kind of one of the ways that it works. So it's killing the fungi's ability to make its own cell wall. Can, on the other hand, actually interferes with the way that the fungi cell's membrane is made. So you know how a human cell needs like cholesterol in the membrane for it to function well? So glucan kind of blocks the cholesterol equivalent of the fungi's wall or cell wall. And when it doesn't have this structure, it cannot survive. Again, we're destroying the cell membrane, and if the cell membrane doesn't exist, the cell doesn't exist, and voila, fungi dead. Okay, so that's kind of how those two meds work. They're kind of their mechanism of action, but they are very effective. But the important thing is they have to be taken for a while. This is not something you take for 7 days like an antibiotic and you're done. Most studies show that they have to be taken for weeks. In fact, we usually say patients need to be on this for 2-3 months to see a significant difference, okay? Fungi, they don't want to die, trust me. And they know they're very good at hiding, and they hide from the bloodstream. So when we have issues that with diabetes, for example, where you've already lost circulation to the foot, or high blood pressure has caused some arterial problems where you're not supplying good blood flow to those periphery, well, you're not really going to deliver that medicine efficiently to those areas. And so it takes time before these medicines are effective. So you might be taking it and a month has gone by and you're like, I'm not noticing any difference, I'm just going to quit. Well, that's what the fungi wants you to do, okay? So you don't want to do that, okay? You want to take it, okay, and take it for the right amount of duration, and kill this off. Okay, we've had patients that had to take this for up to 9 months. Okay, but the trick is every 3 months we do check the function of the liver, make sure we're not overdoing it, overly hurting the liver. So we check the liver enzyme test in your blood work to make sure that everything is good before we move forward. Okay, so treatment duration is important, and same thing for the supplements. When you're using the supplement or the natural therapies, you have to realize you're gonna have to do this for a while. Okay, you're not doing it for 1 week and then stopping. You're not taking that biotin for 1 week and going, my nail's not growing yet. You have to take this for months and months. Okay, so it's very important to understand that the pathogen that you're dealing with does not want to die easy. Okay, so you have to stick to it and be consistent, and until you see improvement in your nail color, discoloration, in the thickness of your nails, how well it's growing, and things like that. And if you can avoid it, don't use any nail polish while you're doing this, so you can really see the changes as it's happening. Because the new nails is going to start growing from the back, and you want to see as that's pushing that whole bad nail out, and you keep trimming them off, keeping the area dry, keeping the area clean, remembering to soak in those apple cider vinegar, or if you decide to use Listerine, as often as possible. Okay, so hope this has been helpful. If you've tried any of these methods and it has worked for you, I would like to hear about it in the section below. Also, if you've tried them and it didn't work, let us know how long you took it for. What combination of things did you do? Did you take the prescription and do some topical? Did you just use one or the other? Share in the comment section below so we can see about helping other patients that might be dealing with this. For everybody, one way might work, but other ways might work for someone else. But we'd like to hear your feedback. And don't forget to like and subscribe. I'll see you on the next one. Bye for now.